Good afternoon. My name's Stephanie Kiley, and I'm an occupational therapist and a certified lymphedema therapist with over 20 years experience. Today, I'm going to talk to you about compression garments and understanding the essentials with regard to compression garments. Here's my disclaimer: SDK Physical and Occupational Therapy, and note that this presentation is provided for educational purposes only. The content may not be comprehensive or up to date. Views expressed are those of the presenter and not reflective of others necessarily. This presenter does not constitute professional advice. Attendees should consult relevant professionals for specific advice. No warranties regarding the accuracy, completeness, or reliability of the information is present. So let's start with garments helping to maintain therapeutic results. So in an ideal world, the gold standard of care for lymphedema therapy is complete decongestive therapy. So our hope is that patients are working with a certified lymphedema therapist and they're having complete decongestive therapy. During phase 1 of the complete decongestive therapy, the therapist is working to reduce the affected limb. And then they will transition the patient to phase 2, which is the maintenance phase. And during the maintenance phase, the therapist is likely considering how to transition the patient from bandaging and drainage to the best possible compression garments for the patient. So together, the patient and the therapist are starting to consider how they can transition the patient from therapy and putting them in the most ideal compression garment. So how can a healthcare professional assess your garment needs? So let's first start with the population of patients who are coming to us who do have lymphedema. It is almost imperative, it is almost always recommended that our patients who have lymphedema are measured and fitted for well-fitted compression garments. And it's important that this population of patients is working with either their therapist who is well-versed in compression garments or with a certified fitter who's also well-versed in compression garments to help them get into whatever it is that they need, whether it's a glove or a sleeve or a stocking or a sock or a toe cap. So patients who do have lymphedema, we do want them in well-fitted compression garments. However, with patients who do not have lymphedema, we're not always running and saying that these patients should be in compression garments also. It's important to note that compression garments are not considered to be prevention when we are looking at lymphedema. So for better results and more comfort with proper fitting, we want our patients to be very mindful about the garments that they are getting and where they are getting them from. It's important to note that not all medical supply store has a well-versed, experienced fitter. And the same is true for therapists. Not all therapists are well-versed and trained at fitting for compression garments. So it's important that the patients are working with someone who has experience, someone who can help this patient get garments from start to finish. And by that, what we mean is that sometimes the first garment isn't the right garment, and sometimes the garments need to be remade or they need to be adjusted. So you want to be sure that you're working with a fitter or a therapist who can help you with all of your needs. It's also important that as patients that you're able to identify whether or not a garment is fitting you properly or not. Garments should actually be comfortable. They should allow you to be compliant. If a patient comes into us and is complaining that a compression sleeve makes their hand swell more, or a toe cap is making the top of their foot swell more, or if a garment is causing skin breakdown, these are all reasons that might make a patient unwilling to want to wear a garment. That's not right. It's important that a well-fitted garment is not causing these issues, that they are comfortable, and that you can put them on and off and feel comfortable when you are wearing them. So just to review, we want to make sure that our patients are working with certified fitters, whether it's a therapist or someone from a medical supply store, but also that you're getting garments that are going to allow you to be as compliant as possible. So in this slide, I want to show you some pictures of daytime compression garments. Let's just note that I haven't put pictures of all garments here, but I put as many as I could. So the first one you'll see we have an arm sleeve. We're showing you pictures of a glove, of a knee high, a thigh high, and a toe cap. Some other basic compression garments that aren't pictured here might be a pantyhose that comes up along the abdomen and might cover the genitals if there's abdominal or genital edema, and sometimes even compression bras and camisoles, which will compress the breast and the chest area. But what's also important to note about all of these garments is that there's a lot of versatility that comes along with them. So in an ideal world, that picture of the arm sleeve would also be pictured with a compression glove. That with that knee high, that we might have that knee high be a closed toe knee high for someone who needs it, as opposed to an open toe knee high. With the compression glove, we might put a pocket at the top of the hand if that patient needs extra compression at the top of the hand. With the thigh highs, if a patient needs extra silicone borders, we might be adding additional silicone pieces to help keep those thigh highs to stay up more properly. So it's important to note that with these daytime garments, there are so many different accessories that are out there that your therapist and your fitter can help you get, again, if they're not right, and to help make them be as effective for you as possible. Nighttime compression garments. So lymphedema is a chronic condition and it persists throughout the night. It is there daytime and nighttime. And so it's important that we will often ask our patients if they are wearing daytime and nighttime garments. And many times patients will tell us that they do not have a nighttime garment. And our questions back to you are, but lymphedema doesn't go away at night. It's important to treat lymphedema daytime and nighttime. And what's really great about nighttime compression garments is that they provide comfort and support. And sometimes patients will even report to us that they get some reduction in their limb from wearing their nighttime garments. So this almost even sets them ahead, and if they get a little bit of reduction when they go to put their daytime garment on the next day, those daytime garments might be fitting a little bit more easily and more comfortably. So in this slide, I'm going to talk to you similarly about the nighttime compression garments. What I've listed here, the first two pictures are pictures of a thigh high, a quilted thigh high, and a quilted arm sleeve. And just like we discussed on the daytime compression garments, there's lots of versatility with these. These two garments could be ready to wear or custom. The thigh high could be made into a chap where it has an extra piece around the waist. It could be made into a pantyhose, or a 1.5 where comes around the waist and the genitals and the other leg. The arm sleeve traditionally would have a hand piece or would extend over the hand. So those are the two quilted garment examples I have listed here. And in addition, the Velcro garments that I've listed, the arm and the knee high, what's really wonderful about these two examples is that the Velcro garments have the flexibility and the versatility to be used daytime or nighttime. So from a budget perspective, they might be a great thing for someone who doesn't have insurance coverage, or want something, just one garment that they can wear day or nighttime. And with the knee high, that particular type of a garment might have three pieces to it. It might extend over the knee and even over the upper leg. So lots of flexibility and versatility with the nighttime garments as well. In terms of garment types, oftentimes patients won't know whether or not they think they should have a ready-to-wear garment or a custom garment. And again, I encourage you to work with your therapist, to whoever is doing the decongestive therapy with you. Hopefully they can make some suggestions on the best garments for you along with the fitter. But in terms of ready-to-wear compression garments, for daytime use, ready-to-wear garments can be for daytime use and nighttime use. They're typically less expensive, and they're typically more easily obtainable. If they're stocked at the local medical supply store, a patient can go in and just get them off the shelf. In terms of the custom garments are not for everyone. They are often flat knit garments. They typically provide better containment. They're good for patients who have either a unusually shaped arm or leg or hand, where as the therapist we might be wanting to try to get the patient into something specific to their limb. So let's talk about wearing your garments and how to wear the garments. So in terms of a daytime sleeve or a stocking, in order to put them on the best way, what I want to talk about is just some examples of how to put them on and take them off so they last even longer. So ideally, if you're putting on an arm sleeve, you're going to fold that arm sleeve in half. It's going to be 2 layers inside out, and you'll slowly work the garment up the limb. In terms of putting on Velcro garments, you want to make sure you should secure the Velcro wraps with proper overlap, and you want to make sure it's plenty snug but not too tight. When you're taking off a daytime garment, a stocking, a knee high, or an arm sleeve, you want to peel it off like a banana, starting at the top and ensuring that when it's completely removed that it's inside out. This will reduce any tugging and pulling at the top or the bottom, which could overstretch that area. In terms of removing a Velcro garment, you want to peel those Velcro straps back onto themselves to prevent them from tangling and collecting lint. So other recommendations: avoid wrinkling in the garments and bunching in the garments. Avoid aggressive pulling and tugging. Try to use good body mechanics. If you are applying lotion, we suggest that you wait 30 minutes to allow the lotion to dry to don those garments more easily. This slide is showing you some sample doning aids. These can all be found online. Your therapist might have samples of them in the office. Your fitter should probably have samples of them as well. But definitely look into these. If you're struggling to get your garment on or off, our goal for you is for you to be as independent as possible and not have to rely on a family member or a friend. Many of these work very well for a lot of our patients. So definitely look into the doning gloves, the easy slide, or even the metal cage if you haven't seen these before and are struggling to get your garments on. So let's talk about airplane travel. Everybody loves airplane travel. As therapists, our request is please plan ahead when you have airplane travel. It's very difficult for us when a patient comes in and tells us on a Monday that they need a garment because they're flying on a Friday. We need to order these garments ahead of time. And now that Medicare is covering compression garments and a lot of other insurance companies are following suit, it could take upward of 3 to 5 weeks for us to get patients into a well-fitted compression garment, a custom compression garment. definitely much more easy for us to get ready to wear compression garments. Again, if they're in stock, we can get them at our local medical supply stores, or we can order them online. But again, we want to try to have enough time for this, because what's also recommended is if a patient is coming into us and requesting compression garments for a flight, we typically want these patients to try these garments on for a week or two before they get on the plane, and wear them for a few hours a day before they get onto the plane, for a week or two, just so you know what that garment is supposed to feel like. On the day of a flight, we suggest that patients put their garments on an hour or two before the flight takes off, and take the garment off an hour or two after the flight. And if a patient is recommended or it's suggested that they wear an arm sleeve on a flight, please note it's also very important that you wear a compression glove on those flights as well. If we don't put a patient in a compression glove and just in a sleeve, they are at risk for having swelling in the hand, and we want to try to prevent that as best as possible. So plan ahead. If you are getting compression garments, try to wear them for a week or two, a little bit each day, so you know what they're supposed to feel like. And if you are getting an arm sleeve, we want you to also get a glove to prevent the hand and fingers from swelling as well. So how to care for your garments. We typically recommend that patients go to the manufacturer's instructions for optimal care when caring for compression garments. With daytime garments, we really do recommend that patients wash these daily. Your garments act as a second skin, so they're collecting a lot of dirt and grime and sweat, and you want to prevent any risks of infection, so washing those garments daily. With nighttime garments, again, you're not outside, so if you're not sweating excessively, you could probably wash those weekly. If you are sweating a lot, we might recommend that you wash them a little bit more frequently. You can either hand wash your garments, use a mild soap or detergent, wash them in the sink, roll them in a towel to remove any excess water, and then allow them to air dry. Some of the manufacturers are now suggesting that it is okay to either wash your garment on a delicate cycle or dry it on low, but again, see each garment's instructions for specific care. The newer models of washer machines are less aggressive, so what some of these vendors are saying is that putting them in the washer machine about once a week actually helps to reshape the garment and remove any dirt and grime. And then lastly, we always recommend avoid fabric softeners that are used on wool or silk, as they can actually break down the elasticity of a garment. So maintaining your progress. So now that, let's just hypothetically say a patient has gone through complete decongestive therapy, the therapist and the fitter have gotten the patient into a well-fitted compression garment. How do you maintain the progress? The recommendations for this are you should be in your garments daily. Daytime garments should be worn 10 to 12 hours a day, and nighttime garments should be worn for 8 to 10 hours a day. Obviously, your therapist could give you additional advice on that. It's important that you reassess your limb every 6 months. You should return to your therapist's office every 6 months to have them check. Has your arm or leg gone down? Has the volume gone up or down? Do you need additional therapy, or have you been maintaining the limb and the affected area well enough that it's okay? But stay in touch with the therapist to see how your limb is doing. And then lastly, you want to replace your garments every 4 to 6 months. Most compression garments naturally break down after about 6 months of regular washing and wearing. Silicone bands lose their elasticity and start to break down, and the garments in themselves just lose the ability to be reshaped. Thank you so much for joining me today. I hope you learned as much as you could about compression garments.